Hello, my name is Dr. Brad Ryan, General Surgeon here at Spotsylvania Regional Medical Center, where we remain diligent in our fight against COVID-19, where the health and safety of our patients, caregivers, and community remains our top priority. We continue to monitor the trajectory of the pandemic and have begun to reintroduce procedures that our patients need. Many people in our community have medical conditions unrelated to COVID-19 that cannot be ignored. We at Spotsylvania Regional Medical Center are committed to caring for you like family. We want to ensure proper treatment in a safe and healthy environment. So let's walk through the typical patient experience on the day of surgery at Spotsylvania Regional. Everyone in our community that enters Spotsylvania Regional Medical Center, from patients to family members to caregivers, first passes through a screening point at our front door. Next, we enter the main foyer, where, maintaining proper social distancing, you'll meet our receptionist at a registration desk. Once checked in, we'll head on down to surgery. After registration, we arrive at the preoperative area. All patients at this point have received appropriate coronavirus testing. And to walk you through the preoperative process, I'll introduce you to Gina, our perioperative nursing manager.
Hi, welcome to Spotsylvania Regional Medical Center. My name is Gina and I am the manager of the pre-op testing area. Outside of your normal testing, we have added the COVID-19 testing for your safety and the safety of our staffs. And today I'm just going to walk you through the process. This is the door where you'll be entering. This is on the side of the hospital and it's labeled surgical pickup area. Once again, we wanted to make this as easy as possible for our patients. So you will just be pulling up in your vehicle right in front of these doors. You'll be greeted by the nurse. You will not have to leave your vehicle or do anything else but have the test completed and you will be on your way. Now we'll go back to Dr. Ryan to talk more about the surgical process.
At Spotsylvania Regional Medical Center, we are committed to the care and improvement of human life. It's who we are and it's what we do. When it's time, we enter the operating room, which is already the cleanest area in the hospital, but now with enhanced cleaning procedures in the context of the current pandemic. We continue to practice social distancing. All personnel wear masks, which does exceed the CDC recommended guidelines for personnel in hospitals. COVID-19 positive patients are isolated to other areas of the hospital and even have their own entrance and exit sites. As in other areas of the hospital, we've instituted heightened infection prevention policies, including the removal of high-touch items such as magazines, toys, and vending machines. Food and drinks are prohibited in clinical units to prevent the spread of illness. So with continued social distancing, heightened hygiene practices, isolation of potentially infected patients, we're enabling our patients in our community to have their procedures performed in a safe and healthy environment without risk of transmission of coronavirus. If you have any questions, feel free to reach out to our consultant nurse hotline 24 hours a day, day or night, or feel free to check out our website, spotsrmc.com.